In this video, I'm going to talk about carpal tunnel syndrome and different ways that you can think about treating carpal tunnel syndrome. So first, carpal tunnel is the term for when the median nerve gets compressed as it goes under the transverse ligament in the wrist. And because of that, the median nerve innervates these 3.5 fingers. So basically, think about these 4 fingers, but on the palmar side or the thumb side of it. And the median nerve, as it runs from here, it goes up the arm and into the base of the neck. So if we trace that in reverse, the median nerve comes from the C5 to T1 segments in the lower neck and upper thoracic spine, as it runs through the thoracic outlet as part of the brachial plexus, so the medial and lateral cords of the brachial plexus. As it winds through here, it then travels along the brachial artery or just next to the brachial artery in the arm. So if you see here, it runs through this area here, and at the elbow, it dives under the pronator teres muscle. So, and for the median nerve, the muscle that turns the hand down this way is when it's the pronator muscle. So the median nerve dives underneath or between the heads of the pronator teres muscle, travels through the forearm, and then enters the wrist right about here to innervate these 3.5 fingers there. Because of that, it can lead to signs and symptoms such as numbness, tingling, or weakness. And my sister-in-law, who I was helping treat this problem, the complaint that she was having is recently she'd been doing a lot of yard work outside, which is a lot of gripping and twisting type of movements of the hand. And then she would really notice it when she sleeps. She sleeps like this, and that compresses off the space in the median nerve. Now, at the same time, her posture is very much here. And what that does is it pulls the shoulders forward, so that creates some tension through this area. Think about it, if your shoulders are forward and you try to turn your neck, you're going to be blocked by the movement of the upper trap and the postural position of the shoulder and how the shoulder blades draw forward. So even though we talk about carpal tunnel as an issue at the wrist, we need to trace it all the way up to the mechanics that are happening at the neck through the thoracic outlet, the position of the nerve and the muscle along the pronator, and then finally what's happening down here. Because oftentimes the median nerve, while it's getting compressed here, it's receiving extra pressure at different points of junctional points along the nerve. So things that we did for her, one was when I asked her to do a reverse fly type of movement, that motion it's often more of a scap squeeze with elevation. So it's turning on that upper trap and feeding into this sort of posture. So one thing that we worked on was getting the shoulder blades to drop down, engage the lats, engage the serratus anterior, which pulls the shoulder back. So instead of being up like this, drawing down and engaging these muscles through here. That takes tension off the median nerve and the part of the brachial plexus through this area of the neck. So we did an exercise to work on that. I had her on a foam roller, and we were working on opening up the chest muscles, opening up all through here, and then at the same time strengthening the back in that position. So we're stretching the pec muscle, which the nerves need to run through there, opening up that position, and at the same time strengthening the middle trap and the lower trap, the scapular muscles on the back side of the body. Additionally, there was a lot of tension and tightness through these muscles all along here. So I had her roll out those areas, or just myofascial release of that to decrease tension in the muscles that innervate the median nerve innervates those muscles. So loosening up this tissue through here is going to be crucial. But the take-home point is that even though this gets blamed for it, and so she's wearing night splints and stuff like that to help with positioning in the evening, here is kind of the blame or the cause of it. But what we need to treat is the entire chain. So doing things that are going to strengthen the shoulder blades and keep all of this in a good position, making sure that the neck can move freely and it's not getting pulled into a forward head position too much. So strengthening everything from a postural standpoint from here, opening the pec muscles, strengthening the back, and then lastly loosening up the forearm musculature to make sure that the nerve isn't getting too much pull or compression this way, which is going to narrow the position of the carpal tunnel. So that's a holistic approach to how to view carpal tunnel syndrome and how to treat it all the way from the neck down into the wrist and hand.